Hi, welcome to DT Mining. I am Celeste Gomez. I am in charge of health, safety, and environment. So, here we are to explain you the use of the step back card. For those who are already familiar with the management tool, safety management tool, it will be a refresher. And for those who are not, this is a great place and time to start. Okay, so our step back card is our safety management tool that help us to understand the risk around our performance and how to mitigate this risk and best ways to communicate. So let's start with the first side of the step back card. So you can see here that the first part says 2 times 2, and it means look and see the hazards, assess the risk, and take appropriate action. So if you open the step back card, I wrote here the type of task that I am going to perform. Let's say I'm gonna be cutting core. In order to do that, before jumping into action, you need to make sure you're wearing your PPE. And I will follow with you the next type of questions that we need to ask ourselves. Okay, so here are the questions, and here you can tick yes or no, and it will give you a better impression and understanding of the level of risk that you are going to face. I'm going to read a couple of questions. Have I look and identify all the hazards? Will the job be done as discussed? Can the job be done without causing an accident? Have I identified emergency devices and locations? Do I know what to do? Do I have a safe access from my work area? Access or exit in this case. Is my work area clean and tidy? So answering all these questions, it's a very good example of what a pre-shift inspection should be, not only for your workplace, but also for me. Am I ready to perform the task? Okay, continuing with the example, the cutting. If we move into the second side of the step back card, let's imagine that for this example, there is a potential risk of losing a finger because you are working with the Corso. So that's a risk that you have to analyze. So let's go with that example. What happens if you cut not only a tiny cut, but if you cut a part of your finger? Let's go with the example. What will be the type of impact if you can see it here? So the type of impact will be significant. Where is it? Sorry, I can't see it right. Okay, it will be serious. I apologize, because to make it significant, it will make you into a disability. So let's say we're between serious and significant. So the level of risk, if you go and take a look here, it's suggesting that is between high and moderate. But let's keep working in the assessment. So moving to the left side, next question that you have to ask, the level of exposure. When you are performing a task, not only in a daily basis, but quite consistent, which is the case for cutting, you will be doing that job for minimum 8 hours if you're jumping into those tasks. So immediately the exposure level will be continuous, as you can see it here. Moving to the left side, what are the chances, or what is the probability of having that type of accident? Well, based on the statistics that we have on DTM, that probability is close to 0. But let's say, again with the example, that it's possible. So if you see the possible here, will give us a better understanding of how the step back card works. So let me draw the line. What we're gonna do now is to connect the dots. I'm gonna mark now all what we discussed. So we said that the type of risk or impact in this case can be significant. We also say that when you're performing the task, it comes a continuous level of exposure. And let's say that is a possible probability to make it. So you see 3 dots here, 1, 2, 3. So what we're gonna do is draw a line, straight line, to connect this point 1 and 2 until the red line that you see here. And from here, you're going to connect the line to the third point to give us a better understanding of the level of risk that we're facing when we're doing cut cutting. So I'm going to do that right now. I'm going to first mark from right to left. Remember, that's the first level. I apologize, it's from left to right. That's the first level of understanding the task. Okay? Sorry, the mirror, right, left, left, right. Okay, so I mark here all the dots and connect it into the red line in the middle. I'm gonna do the next for the third dot. So when we were doing the exercise before connecting the risk, we assume that it will be high and medium. I want to show you that after doing this exercise, it doesn't show that it's between high and medium. It shows that it's quite extreme and therefore quite possible to happen. So what do we do when we face this situation? We take a look at the third part, or the part C of the step back card. And then you have to understand in which color you show your draw here. It's orange and red. So take that, I'm gonna mark it here. Same level of color in the part C of your card, and it will give you suggestions or guidance of what to do based on your risk assessment with the step back card. So here, you need to ask a supervisor to make a recommendation, ask a specialist with more knowledge to advise on how to proceed. So let's say I am a core technician, I'm cutting core, and I just finished my step back card or my risk assessment with this tool. What do? I go and ask my supervisor, that can be the geologist, that can be the health safety specialist, or even the chief geologist, who have more experience and more knowledge of the level of risk. So I identify a risk that is classified as highly dangerous. What do? Let's go there, inspect again the heavy equipment or the tools that we're gonna work with, understand the functioning, understand the use of our PPE, your safety glasses, your hearing protection, your gloves. All those elements contribute to minimize the risk. And you understand the process, you have received your safety training on how to use the saw card. So analyzing all those elements immediately will reduce the level of risk. What you have to do now is do again another calculation of the risk to understand if it's possible. So if I am already using all the PPE, and that includes protective gloves, therefore by default I'm not going to cut myself, and if I cut, it's going to be a minor cut because I know what I'm doing, the risk or the impact will be minimum. So we're going to do it again. If I'm already using all the recommendations, what will be the level of risk if I cut myself with a core? In this case, let's say is moderate, as pointed right here. I'm going to have a little bit of bleeding probably, and of course I'm going to report it to my supervisor immediately. Okay, and the exposure still continues, that's still there. And what is the possibility or probability of that to happen if I'm already minimizing all this risk is heard of. You can see it here. So again, I'm going to connect all the dots. It's heard of, it's continuous, and it's moderate. So again, I'm going to draw a line to make sure that I understand the level of risk that I am playing with now. From left to right, not the mirror. Okay, here I connected my first line. You see, immediately changes the angle. And I'm going to connect it to the second part of the card right here. So as you can see by default, it shows the level of risk to be medium. So what do you have to do? Go back, and according to the colors that you can see in the back, you will see that you have to apply safety checks like job safety inspection, PPE procedures, and do the job in another way that doesn't put you at risk. So in theory, you have to do the risk assessment using the step back card twice. And why do I say in theory? Because with the practice, you will get familiar with the system and you will only use the step back card once, which immediately you will apply the recommendations suggested in the step back card. So that's the explanation of the step back card. How often do we have to use it? Every day. Every day, even if I'm cutting cord every day, yes, that is the answer. When you're doing the same task for a long period of time, because that brings exhaustion and fatigue. So you always have to be aware of what are your risks. When you're doing a new task, you're going to still be using your step back card. When your task is just driving because you have to send some samples to the lab, again, only the step back card every day. If it's driving, if it's just in my computer, if it's core logging, if it involves just carrying carrying heavy samples, every time you have to use the step back card. So this is our best safety tool to help us understand what are our risks and how do we approach and mitigate this risk. Okay, thank you. Let me know if you have any questions.